How can you folks at home prevent bone loss in the mouth? We'll discuss this in depth with dentist Larry Sapoznikov. Hello, Dr.
Hello
Sapoznikov.
there.
Can you tell us what is the primary cause of bone loss in the mouth?
The primary cause of bone loss in the mouth is tooth loss. That is, we don't really stop to consider bone loss as an issue when all the teeth are present. But once teeth fall or get extracted for whatever reason, we then start checking the amount of bone in order to restore and reconstruct the parts that are missing.
So it's enough to pull out someone's tooth without replacing it with an implant, without providing something that would give some kind of resistance, as it were, when they chew. The bone that was under the tooth, will that weaken?
Absolutely no doubt about that. And it will shrink to such an extent that it would be hard to afterwards. I'm not even talking about dental implants. Sometimes it deteriorates so much that implants are no longer a viable option, but even the most standard restorative work, like a bridge that was done in the past, or even removable prosthesis without a crest, there's nothing to support the restorative work.
How can this be prevented?
I recommend, and I don't only recommend, in fact, I believe it should be the standard of care, is that when a person loses a tooth, extracts a tooth, or has lost teeth not so long ago, it's really best to do it immediately, right after the extraction of the tooth. In order to maintain the crest after the extraction, it's necessary to add a bone graft.
A bone graft?
A bone graft, not a dental implant, because a dental implant doesn't fix the bone in place in itself.
Hang on, if you're pulling out a tooth, when you're pulling it out, the jaw bed, the crest, it is still high.
Exactly. So to maintain the height of the crest, it's necessary to add a graft.
Now, is it a bone graft from the patient or autogenic? Or is it a powdered bone? Or bone from a bone bank?
Right. So there are various types of bone grafts, which are made up of, there are two primary groups. The main group, which is the best one, is an autogenic graft from the same patient, and everything else, bones from cadavers or from animals, i.e. xenografts or synthetic grafts. There's a highly developed field nowadays of synthetic grafts. Of course, the best option is a graft from the patient.
But if you're talking about a graft from the patient, they'd have to undergo another minor operation to harvest the bone, right? Can it be combined with the extraction procedure, this minor surgery of harvesting the bone and grafting it in the patient's mouth?
That's a really good question. The moment we extract a tooth, in order to use an autogenic bone graft, a graft that comes from the patient himself, that requires a secondary procedure. Best case scenarios, tissues harvested from the jaws, but in extreme situations, hospitalizing them and harvest from the skull or the pelvis, from anywhere in the body, and graft it where they lost teeth and no longer have bone tissue. But I'm talking about particularly extreme cases.
So you're saying that's not practical?
No, it's not practical. The best, most effective option today, and this has been shown in a large clinical trial, which we recently finished at the medical center, is a bone graft from the actual tooth that has been extracted. The actual tooth we extract, we use a procedure where we
you grind
we
it.
grind it. It's a 10-minute procedure. There's a kit for it, a device. The device grinds the tooth into particles of the proper size, because it has to be a specific size, in order for the cells to interact properly with these particles and create bone tissue. And we also perform a type of cleaning, a decontamination or sterilization, though it's not sterilization because there's no gamma irradiation, but it becomes practically sterile.
In other words, you disinfect the tooth you remove.
Yes, we extract the tooth.
Yes?
We extract the tooth.
You grind it in a special device.
A special device.
And you use the particles to create a graft, yes?
And yes, after a certain disinfection procedure, after disinfecting these particles, we insert them into the socket, and this procedure guarantees with 100% certainty that the crest will not diminish.
How did you come up with this brilliant idea?
The idea came from the fact that there's a well-known phenomenon where people, especially teens, when they lose a tooth as a result of getting hit or any sort of trauma, And when you try putting that tooth back into place, what happens is there's a loss of cells that are like a ligament between the tooth and jaw, and those cells die. And once they die, and we put the tooth back into place, in over 50% of cases, the tooth becomes an integral part of the bone, and the bone slowly absorbs it. We call it ankylosis in our language. This is not great, but once we've observed this process of connection, of fusion of the jaw and the tooth, we came up with this idea that this might be the best bone graft you could have.
And how long do you have to wait before dental implants or caps or any other procedure to perform the restoration?
That's it. The thing, though, is it takes half the time than with any other bone graft. Since we know that this phenomenon of the tooth fusing with the jaw after trauma that I mentioned, I'm talking about the ankylosis, can be as quick as 2 weeks if we replace the tooth without those cells that are like a ligament connecting the tooth to the jaw. We already get a very firm grasp between the tooth and the jaw, which fuse into a single entity. So that's why you...
So it's like two bones fusing when you break your arm and a callus is formed. It's like two bones fusing.
Yes, it's very quick. And we're saying if we're waiting to perform a dental implant after a bone graft, it takes about 6 months in the upper jaw and 3 months in the lower jaw. And with this procedure, that period is twice as short.
Now, a question that may or may not be relevant. A lot of people get wisdom teeth extracted. Is there a point in doing this same extraction procedure with wisdom teeth?
There are many applications for bone grafts from an extracted tooth. With the wisdom tooth, it's worth using the extracted tooth for a graft in order to safeguard the adjacent tooth, because when you extract a wisdom tooth, sometimes the root of the adjacent tooth becomes exposed, and that gradually causes receding gums and bone loss. So in order to safeguard that tooth, it's worth using the wisdom tooth. Not to mention the fact that we can use that same extracted tooth and take it from one location and move it to a different location
in the same jaw.
The same jaw.
That's a thought. You could really, that just gave me a good idea. You could extract the wisdom teeth people aren't using, and maybe they'll have less wisdom, but they could move them elsewhere.
They'd have a bone bank. We're creating an entire bone bank of them. That's right.
Thank you very much, Dr. Lari Sapoznikov.
Thank you.